The disaster management, as I told you, the disaster are two types. One is the inside disaster, other is the outside disaster. So in this picture, you are watching the disaster management inside the hospital, we call triage. So if you ask me what are the compare and contrast between inside disaster and outside disaster management, let me explain. So inside disaster management, we give the priority most the patient who need instant your help, and you can save the patient life. So priority is the most important in inside disaster management, or inside me, or we say internal disaster, means inside the hospital. First of all, in here we can say we categorized the triage in four type. One, or some book wrote the class 1 or red tag, immediate care. Number 2, priority 2 or class 2, yellow tag, means little bit delay is not a big problem. And priority number 3 or class number 3 are green, minimal. So patient can wait even more a few hours and they will not die. Class number 4 is expected, black, means they die. Whatever you do, patient will die, right? Expected, or class number 4 or black tag. Black tag, I said. So during the disaster management, nursing action is very important, whatever inside or outside. So first of all, inside the hospital triage, we have to think critical way. See, and out of all patients, see the worst scenario first, right? Worst patient need help first, and we will follow the ABCD management basically. Or in my another class, I already explained what is ABCD principle in nursing. It is very important. A stand for airway. We have to ensure patient airway is clear. Stabilize the cervical spine if neck or head trauma is suspected. ABC, B for breathing. We have to assess for respiration. And C for circulation. Check the heart rate, blood pressure, and capillary refill. D stand for any other disabilities. Assess the patient the level of consciousness. And E stand for exposure. Assess the patient's body for trauma, exposure to the heat or cold. You have to save your patient. You have to remove the patient from any source of injuries, right? So we are talking about the inside or internal disaster or triage. So I want to give you some example here. Like in this picture, you can see priority number 1, life-threatening injuries, survivable with minimal interval. So patient condition is so bad, But when you give them little bit, they survive. Like patient has an obstruction the respiratory tract, you remove the obstruction and patient can survive. Example 2, patient have oxygen saturation is too low, you give oxygen and patient survive, right? So when you assist patient and patient, you can save patient life. Priority number 1, they are complicated, okay, and they are completely will be stable, but they need your help, right? Example are like chest wound, airway obstruction, shock, pneumothorax, second degree or third degree burn. Other example I want to add with it, like loss of electricity in the whole hospital. It is also the inside disaster or chemical spell, right? All of this. So the red tag, immediate treatment is required. Immediate treatment to save the life, like breathing issues, hemorrhagic wound, or major burn. What else? The priority number 2 or delay yellow, so may require immediate attention but can sometime wait for the hours. So like patient need your help but they're not the first priorities. So if you go little bit delay, they can survive. Why you will be delayed? Because you have a priority patient number 1. After finish that, you have to go the priority number 2. So in class 2 or yellow tag, major injury that require prompt the treatment, like bone fracture, like a hip bone fracture. Patient is severe pain, but blood loss is important. If you do not stop the blood loss, patient will go under the shock. So what the other example, like abdominal wound or without evidence of hemorrhage, internal hemorrhage, there are no external injury sign, very hard to predict. So soft tissue injury or genitourinary injury, eye injuries, or central nervous system injuries. It is the priority number 2. So also it is, I want to add something here because we need NCLEX related information. So first aid, you know, in the every hospital, first aid box is there, right? Because first aid, like bleeding, it is the first aid is enough. Fracture or any frost bite, burn, everything including in the first aid, right? Like I'm example bleeding, you apply the direct pressure on the wound or do not remove the implanted object or stabilize the patient, bleeding will be reduced to the first aid. So we has to have a good sense about the first aid as well. So next here I said priority number 3, which is the minimal or green. So in class number 3, green tag means minor injury, and minor injury does not require immediate treatment like priority number 1. Some of the example of priority number 3 are upper extremity fracture, minor burn, small lacerated injuries, or psychological disturbance. What else? I said abrasion, any cut or Spain, all are class 3 or green tag. The yellow tag or last one are the priority number 4 or black tag. So injuries are intensive. Injuries are intensive and chance of survival are unlike. So patient, whatever you do, patient will die because of our clinical experience, our anatomical knowledge, physiological knowledge, or pathological knowledge. We have a ability to predict our patient what will going on. So what we do, patient will not survive. This expected to die, black tag. So I said the black tag is expected and allowed to die. Example like penetration in the head or head injury, chest crush injury. Burn is more than 60% body surface area in get involved, or seizure or vomiting within 24 hours of exposure of radiation. Like patient is road traffic accident and very bad head injury, and patient has a seizure and vomiting within 24 hours, the less chance of survive. Or profound shock with multiple injuries, or absent if patient absence pulses, blood pressure absence, dilated pupil, all are the sign of danger. They are going to die. So they are tag number, black tag or class number 4. So all of these are the inside hospital disaster. So on the other hand, I said sometimes disaster in the outside or emergency disaster management for the public safety, like flood, very bad earthquake, suddenly broken the bridge or building. So I said external disaster, the picture you can see, some of the picture are showing here, the external or natural disaster. So here, so I said the external disaster, easy way to remember, just think DEAD, dead last, means we has to work in, or we can say they assist the living or unresponsive patient first. So in outside disaster, we has to give the service the patient who have a very minimum injuries. When anybody is minimum injury, if you give them the treatment first, they will help you for the patient, another patient, because the outside the hospital, right? Let me recap. In outside disaster, usually outside the hospital, or if I ask you in outside hospital or outside disaster, how you respond in the field, right? So also I said we has to give the treatment who have a minimum injury first. It is important. And also I want to add something, like tornado is a outside disaster, or any chemical explode bombing or hazard materials, or I said sometimes, bomb threat is also the outside disaster like tornado. So we has to close the shed, move the patient away from window, or place the blanket over the patient who are bedbound. In case of chemical explore, we undress the patient, irrigate profusely, or for dry chemical, we brush the chemical off the patient clothing or skin. Do not use any water. Any other danger or hazard materials if explore or expose, always locate the safety data sheet, or water is the universal antidote in case of hazard materials. And if any kind of bombing threat, what we have to do, keep the caller on the phone, or as long as like anybody is make a phone call and give you the threat about the bombing, so what we have to do, we have to keep them in phone as long as possible and listen for background noise if you get any kind of clues.